It is my pleasure to introduce our presenter, Dr. Mahadeo Sukai. In the world's first congenitally blind geneticist. Mahadeo is Vice President, Research and International Affairs and Chief Accessibility Officer for the CNIB. Having previously served as a researcher at the University Health Network in Toronto, Dr. Sukai is a leading expert on accessibility of graduate and postdoctoral research training in science, technology, engineering, mathematics, and healthcare disciplines. Dr. Sukai is the chair of the Employment Technical Committee for Accessibility Standards Canada, as well as the external co-chair for the Canadian Institutes of Health Research Expert Advisory Committee on Accessibility and Systemic Ableism. Please welcome Mahadeo Sukai.
Good afternoon, everybody. Thank you very much, Jennifer, for the introduction, and thank you also to the organizers for inviting us to give this presentation to you today. What we will do this afternoon is actually share some research findings with you from a project that was undertaken last year by my team at CNIB Research to understand the type and quality of barriers experienced by persons who are deafblind and who live with dual sensory loss in Canada. This was a project undertaken as part of the consultation process for both CNIB's and Deafblind Community Services strategic plan work that was undertaken in 2022. The project was the largest of its kind and really the first ever really comprehensive 360-degree attempt to understand the barriers and the quality of life experienced by persons who are deafblind in Canada. The work involved surveys and focus groups. They involved consultations with persons who are deafblind. It involved consultations with caregivers, support persons, friends and family. The work was led by Akriti Pandey, who is the lead of strategic research on my team at CNIB. I'm really pleased to give Akriti the opportunity to present this work to you today and really tell you the story of what we learned during the work that we did last year. So I'm going to turn it over to Akriti and disappear until the question period.
Thank you. Hello, everyone. I hope my voice is clear. Sorry to anyone who came here just to hear Dr. Mahadeo speak, but I'll try to do justice to this. So my name is Akriti Pandey, and I am the lead research strategy for the Accessible and Explainable AI project that we're doing. But right now, I'll be talking about what can we do about barriers to participation and social inclusion in Canada. So in this presentation, I'll talk about the surveys that were included in the analysis. I'll be talking about the community survey that CNIB clients filled out, the friends and family survey that also CNIB clients filled out, the ASL survey for the deafblind community, and that had a small sample size, but it was still worth noting, and then the results from the DBCS client focus groups. So as I mentioned before, this survey had a very small sample size. There were 28 people who interacted with the survey, but there were only 9 who completed it. And the reason why that is probably because it was really long and extensive, but it was also very necessary to ask all the relevant questions. So that means we had approximately 32% completion rate. Now, all the respondents were over the age of 50. And all respondents who chose to disclose had moderate to total sight loss. So keep these demographics in mind while I'm talking about the results. There were also 6 out of 9 respondents who lived in a town which was categorized as 15,000 to 100,000 population. So I would categorize it as medium, small to, I guess, large as well, if you consider 100,000. And all the respondents who disclosed had a household income of less than $60,000 per year. So I found that there were average of 3 settings per person in which people encountered barriers. The survey had 10 sections. So we had education, we had employment, we had healthcare, government services, and advocacy. And these were some of the sections. And the top 3 settings that people mentioned they encountered the most barriers in were daily living, in the community, and accessing healthcare. Now, this might not be news to you, but it was definitely good to know that we're kind of seeing the results that we have heard other people say. So daily living consisted of questions related to self-serve kiosks, emergency messages in an apartment building, cable watching, streaming services, and using the internet, the accessibility of websites, etc., so just in case you were wondering. And there was an average of 5.7 barriers per person. So that is a lot of barriers, so keep that in mind. And the top 5 barriers were safety concerns, being able to get around indoors in a building, access to the right technology, being able to navigate between buildings outside, and then accessible parking. So now let's talk about the subsection of deafblind individuals who filled out the CNIB community survey. The CNIB community survey had around 2,000, more than 2,000 respondents, but the subsection where there were 219 respondents. We did the surveys in both English and French. So we had more participants fill out the English survey, so there were 197 participants there, and then 22 in French. So the median age in this case was 62 years as compared to the other one where it was 50, with 72% of them over the age of 50. The median age of onset of sight loss was 38 years, so basically when they figured that they had sight loss. And 41% said that they were over the age of 50 when they had the onset of sight loss. 95% of people had moderate to sight loss in this case. Other data was that we had 70% of people who were white cane users, and 5% of them were guide dog users. 74% of them were from the white population, and that we realized that was an issue. We wanted it to be a more diverse kind of subset, but there were people who filled out and they were white, so we can't really do anything about that. And then 69% lived in a city of more than 100,000 people. 53% had a household income of less than 60,000 per year. And 53% were retired and 18% were working. So in the question here we asked was, in the past 5 years, in what settings or situations did you encounter accessibility barriers? And we had multiple options, and we asked them to also select all that apply. So in this case as well, it was very consistent with the first survey that I talked about. There were average of 3.6 settings per person. And the top 3 settings were daily living, travel, and in the community. And daily living and in the community were, again, the top ones in the other survey as well. So this survey indicated that people faced an average of 6 barriers per person, which also was consistent with the first one where the average was 5.7 barriers. In this case, the top 5 barriers were almost similar as well. It was being able to navigate outside between buildings, being able to get around indoors, access to information in accessible formats, transportation or transportation to a transit terminal, and then access to the right technology. So another question that I asked was, how frequently do you encounter accessibility barriers in that particular setting? So for example, we were talking about accommodation, that then it would be how frequently would you encounter it in accommodation. And the responses ranged from never to always. The top 3 settings in which barriers were most frequently encountered were educational settings, accessing information for daily living, and a tie between community and accommodation. So we learned about things that, situations where people kind of found these barriers, but what did they do when they actually encountered these barriers? So people were most likely to ask family, friends for support and care, and the answers kind of differed depending on the setting. So in this case, it was the accommodation. So in this case, people were, asking their family and friends for help and support. They brought their own device, and they made arrangements for assistance and accommodation in advance. What they were least likely to do is to do nothing, make a complaint, or pay extra for own devices. So next, I'll talk about in the community, because that was also the top setting that people encountered barriers in. Okay, so as I mentioned, community settings and accessing information in daily living were the top 3 settings. But within the community settings, every person faced barriers in an average of 2.7 community settings. And the top 3 settings within the community were medical offices, restaurants, and public buildings and public spaces. Now, that also might not be a surprise to you. So what were they likely to do in this situation? So in the case of facing barriers in the community, people were more likely to bring their own devices, to do nothing, and to make arrangements in advance. They also were likely to order online and get food supplies delivered at home. What people were less likely to do was to consult a lawyer. They were less likely to make a human rights complaint, and they were also less likely to advocate. Now, the last category is accessing information for daily living. And in this case, people were most likely to, again, ask family and friends for support and care. They were, so they kind of researched tips and tricks on how to use accessibility features, and that's only if there were any. They were also so likely to not use it due to accessibility issues, or they just switched programs due to lack of accessibility. What they were least likely to do was consult a lawyer and advocate, such as participating in focus groups and in other civic engagement activities. So obviously, in this time, we can't do any research without actually seeing the implications of all of these things during COVID. So we did exactly that. I asked participants what kind of barriers they experienced when accessing information on federal and also provincial or territorial level. So these were 2 different questions. But in this case, I've kind of accumulated the chart. So I'll just go over the top barriers. So the top barrier with 57% respondents in the federal level was that the websites were not easy to use with their devices or for a person with disabilities. Now, this was worse in the provincial and territorial level, with 81% of participants saying they had this issue. I was surprised to see that the numbers were really high, but it was given that federal level would be better than municipal or territorial level. And the other barriers that mentioned were that the information was not in plain language, that websites were not accessible or compatible with the assistive devices, and videos or announcements were not closed captioned. So I've been talking a lot about numbers, and I'm sure those exact numbers won't stick in my mind. If you ask me by memory, I can't tell you. So what I'm going to do is go to the focus group results, because that's more people telling us, we had those in-depth discussions, and those are actions that can be taken. So I'll go to that section first, and if time allows, then I'll go back to the friends and family survey. All right. So in this case, 5 focus groups were held in all 5 DBCS service areas, that's Deafblind Community Services areas, with 21 participants. And some of the key findings were that participants said that they find that there are insufficient number of interveners skilled in ASL. Now, because the number of interveners with that skill is so low, it also puts a lot of pressure on the ones that do know the language. It also means that the wait times are longer due to unavailability. Now, in general as well, there is a shortage of interveners, and that also leads to a lack of flexibility in scheduling. People also said that they're really interested in more community-building social events and social support groups. They do say that sometimes they feel isolated, and just like any other person, they want to connect with other people as well. And they want to participate in activities like volunteering and recreation. Now, the general feeling in all the people we talked to was that intervener services are life-saving. Now, what I mean by that is some of this was going back to mental health, where without interveners, deafblind individuals are unable to participate in society to the extent that they would want. And that definitely impacted their mental health. So having interveners is not just a luxury, but also a necessity. So I'll go into detail about the very first comment. So participants want interveners who are proficient in ASL, and they want to be paired with the interveners according to their needs. They said that miscommunication can result from pairing with interveners who do not understand them well. So one of the examples was some person was really adept in technology and the intervener was not. And so they were paired, and so the intervener wasn't able to do the things that the individual wanted. And they said that it was a lot of miscommunication, a lot of teaching from the participant's side, and that not only kind of, I wouldn't say wasted, but it did consume their time, and it's not the best for them. The other thing was, So participants said that they can feel defeated when this happens. Now, if there's a mismatch between the skills of the interveners and the needs of the participants, communication is not easy, making them feel dependent and guilty. And they also said that lack of proficiency in ASL could be dangerous, particularly in healthcare settings. So they said that miscommunication would have led to fatal outcome if not caught in time. And the example in this case was one particular individual said that a family member who also accompanied them in the healthcare appointment. So they kind of caught the intervener's mistake and realized that what the intervener was saying was completely different from what the doctor was saying. And so in this case, if this was not caught, it could have been detrimental. Now, that's not to say that all interveners do that, obviously, but sometimes when they're not proficient in some language and they have that pressure, it could obviously lead to some mistakes. So the comment was just thinking about it makes them scared. In the terms of intervener skill sets, they said that there should be standard training for the DBCS interveners, and so that all interveners are equally skilled. Participants noted that not all interveners have the same training, and when participants get a different intervener, they need to get reacquainted, and sometimes they need to teach them about their ways, preferences, so whatever I was talking about in the previous slide. Now, the deafblind interveners should either take initiative to learn things that their clients need, or the DBCS should provide training beforehand and before sending them out in the field. There was also an issue with supply and demand. So lack of interveners leads to long wait times during emergencies and appointments and rescheduling. They said that having more interveners will give them, will give clients some flexibility with their schedule. For example, clients mentioned that they can often miss out on last-minute plans because there are no interveners available. Participants stated that they need to plan their schedule weeks in advance, which is obviously not how life works. Sometimes impromptu things happen and you want someone to be there, but you can't and you just have to miss out on it. And they also raised the topic of after-hour events, such as like church or other social events that they want to be part of, but they weren't able to attend due to the lack of availability of interveners. So scheduling and dependency. Participants mentioned that being dependent on interveners, that they're dependent on interveners, and then if the interveners are late or that they have to leave early for whatever reason, participants are unable to complete their tasks. Accessibility of interveners is important so that if one intervener's scheduled time is over, then the other intervener can take over quickly. And that was a very common theme where they said, I'm playing a game of bridge, and the intervener said, my time is over, so let's go. And that obviously creates an unpleasant feeling for the participant as well. And participants noted that they were not able to participate in events for the whole time, so that's the game of bridge, and did not have enough time to complete errands and were not able to schedule another intervener for hours sometimes. So building a community. So participants, now because this project was for the DBCS, I keep saying DBCS, but that's not to say that these cannot be used by other organizations. Any organization that offers similar programs can definitely take something from this presentation and implement that. So participants would like to connect with their community and be a part of year-long events and not just like Christmas, like annual events. They said they always want to be connecting just like any other person would. And sometimes that's not possible, again, due to unavailability of interveners. They wanted DBCS to host events or help participants connect with other clients to help improve their social, emotional, and mental well-being. Peer support groups were also mentioned quite a few times, where participants agreed that they enjoyed being a part of the community and helped each other out in whatever little ways they can. So even like events like this, where they're networking events and you're just here talking to people, and that kind of gives you a sense of belonging. So that's what the participants said that they wanted to participate in most of the year round. They also said that gathering with their peers gave them perspective on things and taught them valuable skills that they had not known before. So obviously, if you have some skills that you want to learn, sometimes you get tips and tricks from your fellow participants of whoever your friends, and that's only possible when you're actually meeting them, and that's where this comment came from. So when I talked about intervener services are life-saving, so intervener services offered by DVCBS have allowed people who are deafblind to live independently and do activities that people with disabilities or without disabilities are able to enjoy. They also said that it has increased their confidence. So not everything was negative. There were a lot of positive things as well, and that's what I'm here to highlight. And one of the participants recalled their experience and shared with the group that she was able to go to concerts, other social events, and malls, restaurants, etc., to enjoy other entertainment activities due to the presence of an intervener, significantly improving her mental and emotional well-being. Lastly, there were other comments that weren't categorized as themes, but I think they're noteworthy, and it's good to highlight them as well. So there were mixed comments from people about interveners, in sense of they said that some people liked getting new interveners because that means that you get a blank slate and you might end up matching better. On the other hand, people also said that it was hard for them to get acquainted with a new intervener and then explain their needs to them. So I think we need to kind of create a balance there and maybe ask the participants of the organization can ask their participants what they would like and what the general idea for that organization is. They also said that they had lack of knowledge of safety devices and how to use them. So they wanted DBCS or other organizations to advocate more for safety devices or safety features in the devices that exist already and teach them how to be safe. They also wanted expansion of services in other cities and provinces. So DBCS is limited to some provinces, and so we're trying to get more funding from the government and whatnot, but they wanted it to be available in all the provinces in Canada. They also wanted us to advocate for affordable housing, accessible apps and technology such as alerting devices, flashing lights when the doorbell rings, etc. Not everything is covered by ADP, which is the assistance program, so that's why they said that. And then advocating for deafblind clients and their needs, also teaching them how to advocate for themselves, teaching them about their rights and the resources available for them. So these were all the comments from the focus group. I do have around 6 or 7 minutes, so I can definitely go to the family survey and get the results, explain the results to you. Okay. So in our friends and family survey, we had 273 respondents who identified as being a support person for someone living with sight and hearing loss. The median age in this case was 62 years, again 76% over the age of 50 years. So most of the supporters were female, 78% were female. 54% live with the person they're providing support for. 69% lived in a city of more than 100,000 people. And 66% have been supporting for longer than 5 years. So some of them, we had different categories in what kind of relationship you had. So 30% said they were a spouse or partner. 26% said they were a parent. 20% were adult child. 10% were family member, and 9% were friend. So what kind of supports did they provide? 85% of respondents provided 2 or more types of support to the person living with sight and hearing loss. They were average of 3.7 supports per person. They were average of 3.6 challenges encountered as a supporter. So one of the questions was, in the list of these challenges, can you describe what kind of challenges you faced? So that's where the data came from. And then 34% of respondents encountered 5 or more challenges, which is definitely a lot, and it puts also emotional and mental kind of pressure on the supporter as well. So some of the types of support provided were companionship, so talking or reading. We had transportation, so driving to doctor's appointments or driving for errands. We had homemaking, so shopping, cleaning, and preparing meals. That's 19%. 15% said they provided some kind of financial assistance, so paying bills and managing budget. 14% said they had healthcare assistance, so help with medications or wound care. And then 8% was personal care assistance, so feeding, bathing, toileting, dressing, and grooming. Some of the challenges that I said that they encountered were, the top one was finding activities that they could participate in and qualify for. And then the other ones were coordinating or providing transportation, understanding and managing their legal, financial, or insurance issues or benefits. Obviously, we can't even manage our own, so it's hard to do it for other people as well. Then we had finding activities that they could participate. No, I already said that. Managing and meeting their social needs, managing and meeting their emotional needs, coordinating and managing medications, medical equipment, and other medical care, so care coordination. They also said that it's hard to see a family member or friend who lives with a disability struggle due to the lack of accessibility and inclusion. It's very frustrating. And then also helping them communicate with others. Sometimes, they feel left out, especially if they don't have interveners or other kind of form of communication. So it's hard to communicate, and that is not the best feeling. All right, so the last slide, I wanted to say what kind of support there were during advocacy, how to provide support and stuff. And they said that 19% wrote to or called government officials to improve issues related to accessibility. And 18%, they said they attended focus groups, town halls, and public consultations that deal with topics related to inclusion, diversity, and equity. That's one of the reasons why I love doing focus groups, because not only does it give them a chance to tell them what issues they're encountering, but also it gives them a space to meet with other people, to actually communicate with organizations, see that the organizations kind of care about these things as well. They also said that 14% actually worked with CNIB staff on an issue. And obviously that depends what kind of issue, right? Sometimes if it's urgent, then you can't really reach out to organization in the moment. But if it's long-term kind of situation, then definitely organizations do help. 12% said public awareness activities, and 6% said they undertook a formal complaint process, which was non-legal. And 6% also said they brought together groups of like-minded people and organizations to work on a shared issue. So one of the also comments we got was that if the organization is not able to do something on its own, then they should kind of teach how to teach these skills to someone who wants to advocate, and then together they can make a force and make the change. One of the examples was something done in Ottawa. They were doing a transportation, like in audibles in the bus and stuff, and they kind of organized it from the start, where they worked with the organization, the participants, and made the change. So that was one of the positive outcomes. And yeah, that's all I wanted to say today. Thank you for your time and attention.
Are there any questions?
There's a roving mic somewhere, and while people identify for questions, I think thinking back to Walter's dueling octopuses this morning, there's an interesting parallel in this presentation between what we heard when we had conversations around mental health, social isolation, and how that related to how people were relating the barriers that they were experiencing with us. There's some additional data from the surveys that actually talked about cognitive load and mental health undertaken during self-advocacy that Akriti didn't talk about because of time. The other interesting thing about all of this too, I think, is when we layered on what the supporters and the caregivers were telling us, we've heard similar things to what some of the other sessions have talked about, which is the importance of providing a level of support and a level of a community for the supporters, for the friends and family, for the caregivers, and providing expert assistance to them when needed as well. And I think taken together, we have a really powerful story of what the landscape in Canada is today that those of us who are based in this country can influence over the next few years. Questions?
Yes. I was just wondering about the slide with all the statistics of what people did when they encountered barriers. Are those percentages overlapping, or are they mutually exclusive?
They're not mutually exclusive.
Thank you.
They could choose multiple things, right, Akriti? Yeah.
Thank you. That's a lot of data. My name's Lauren Lieberman. I do a lot of barriers work. On your questionnaires, did you have any open-ended questions?
Yes, we do. For all the questions that we had other, and then people could specify some of the things that they said. But most of the things that they said kind of fell in this category. We definitely had, I don't remember the survey by heart right now, but we definitely had a couple of open-ended questions, and that's probably not relevant here, and that's why I didn't talk about it. The reason why I limited the open-ended question is because the survey itself was very long. There were 140 questions, and so if I had people actually entering it, it might have deterred them as well, and that's why we also went with the focus groups where they had the chance to actually talk about some of the issues that I might not have included in the survey.
And my follow-up question is, did you run into any issues with attitudes about people in the community or access related to attitudes of people that didn't think that they could be involved or access some of the activities they wanted to do?
Yeah, I think that's where they were saying, even like supporters and people saying that they had challenges finding activities because people just assumed that they don't have the skill or they don't, how are you going to do it? And people had to constantly explain the whole process of how they were going to participate, and that kind of deterred them from doing it.
Can I answer that?
Yeah, and Dr. Mahadi would like to add to it, sorry.
So that's a really good question about attitudes. And what we were able to do with these data was unpack sort of the perception that folks who are deafblind experience with respect to others' attitudes, and we were able to unpack the perception of the caregivers and support persons. We're actually trying right now as a different piece of work to try to probe Canadian public attitudes toward blindness and deafblindness. And one of the interesting things that we're running into when we do that is the whole notion of social desirability bias, and frankly the general public will lie through its teeth on a survey where you ask them to talk about explicit attitudes. So if in 3 years we'll hopefully be able to tell that story at this conference and be able to share sort of the unpacking of public attitudes and the perspectives that you can get by talking to the general public. But I think here we're able to get sort of that perception of that perception of inability, that perception of, you can't communicate, so you can't do. You can't hear, you can't see, so you can't do. And that was coming through in the conversations as well as in the surveys.
We have another question over here. Sorry. Did you have more? Sorry. Oh, here you are.
Hello, thank you for that. This is Natalie. I know that there's a lot of data, so I'm just wondering if you had any thoughts to share on kind of intersectionality, or especially when you're thinking about Canada, if you have any participants from the territories or kind of away from the larger metropolitan areas and differences you might have seen there, even if the sample size is smaller.
Do you want to take that? Do you want me to take that? I can take. So I don't think we actually had anybody from the territories fill out the survey. I think back to the demographics that Akriti shared in the beginning. The demographics are actually relatively reflective of the community who got the survey, and you can parse what I said there, right? So the networks that we shared the survey through have a certain demographic profile. That means we don't have access to everybody. The demographics, however, in many ways, not the concentration of people who live in larger cities, but for example, how many people were white, how many people were not white. That was actually pretty reflective of census level data in Canada. So in some ways we're actually reflective of, in other ways we are certainly not. That 69% who live in cities of more than 100,000 people is a definite skew because the Canadian population is split 50-50. About half of the population in Canada lives in cities of more than 100,000 people, and the rest live in cities of less than 100,000 people. So we were, Natalie, to your point, I think there's groups who were not engaging with the outreach, and that might have either been because we had access to them but they didn't want to engage, or because we didn't have access to them.
Are there any other questions?
We've got 4 minutes and 26 seconds. I don't want to steal people away from the artisanal donuts outside, but at the same time, you know, there's been some pretty good conversations. If folks want to come and chat with Akriti and myself, we'll hang out here for a little bit and deny ourselves donuts for a few minutes.
This is Lauren speaking. Since you said you have 4 minutes left, I'll ask one more question. So do you, I noticed that a lot of people needed to self-advocate for what they wanted. Do you have any self-advocacy training for people in the community to help them access what they want in the community? Is that something you've thought of yet, or do you have that solution at all?
So that's a good question. Both CNIB and DBCS engage within the self-advocacy coaching space. I think the conversation is distinct depending on level of sight loss. The conversation is distinct depending on level of hearing loss. I also think that a lot of the self-advocacy training, and I'm gonna step out on a limb here, knowing full well that my voice is being amplified, and somebody could go and tell my boss I'm about to say what I'm about to say, and I may not have a job tomorrow. But I think what I would actually say in the context of self-advocacy is there's a million ways to do it, but there's probably 1,000 ways to do it well, and maybe only 10 ways where you're actually going to get the thing that you need to get because you're advocating for it. I think, and as I said, we didn't include these data because of time. There's a lot of mental health pressure that goes along with self-advocacy. There's a cognitive load that goes along with self-advocacy. The notion of self-advocacy and how it relates to allyship and now I'm talking as Chief Accessibility Officer, that's a larger discussion that I think is a community-wide conversation, not just an organizational conversation. So the answer is yes, there's programs. Are they most effective? Are they the right ones? Are there better ways to do it? The answer is always going to be yes from my perspective. And as I say, if I don't have a job tomorrow, now you know why.
Thank you.
Any other questions? Oh, okay, last one.
So this is actually a specific question. Oh, hi, it's Lenny. This is a specific question regarding Ontario and the AODA. What steps should an ally take when an organization that you're attempting to bring someone to participate in is, for lack of more polite terms, being an arsehole about compliance?
Is the organization that's being an arsehole about compliance an organization of or serving persons with disabilities? Because if yes, you've got a real problem. No. Ah, okay. A bowling alley above another bowling alley. That's a Big Bang Theory quotation for anyone who got the reference. So you know what, if the organization is being an arsehole, you absolutely can sort of throw the legislation at them. You do have to be a little bit careful because the AODA has various tiers of compliance. So if you're in Ontario, if you're an employer of more than 50 people, there's lots of rules you have to follow. If you're an employer of less than 50 people, there's many fewer rules you have to follow. And so what I would say is be careful about throwing the book at a small to medium-sized business, because if they happen to fall in that second group, then the book that you need to throw is actually much smaller and thinner and doesn't hurt quite as much. But my perspective is you know, you say to somebody, it's the law, this is why it's the law, here's why it's the law, here's the proof that it's the law, what are you going to do about it? Would you like me to report you? Because I can, right? And you know, ultimately you can push that conversation as an ally. I think you and the person you're allied with need to make a judgment call about, you know, at what point is this just too much? Right? Michael Gottheil yesterday was giving an interesting analogy about human rights complaints. And are you going to complain for the sake of $5,000 when your legal fees are probably going to be $10,000? Probably not. But are you going to complain when you know you have a case and you can win that argument and really make it stick and make some effective change? Yeah, I think you should. And that's always That's always a case-by-case sort of basis. And if you feel uncomfortable and you feel squirrely about it, then you go somewhere else.
Thank you very much for sharing your results of your surveys with us. I can appreciate, as an individual who works in the services for deafblind people, that sometimes it's very difficult to get participation in these types of studies. So I'm glad to see that you have some data that will be helpful for you as a service provider with government, and teaches us how we need to improve our own services at times as well. So thank you very much. I have a small gift for you here. There you go. Thank you. Very good.
Thank you, everybody.